Hi guys, and welcome back to EverlastCyber. In today's video, we'll be going through the part 4 section of the NACC PSW 2025 practice questions and answers. We'll be starting right off with question 1. Food labels have 3 components. A. List of ingredients, nutrition claims, nutrition facts. B. List of ingredients, nutrition claims, daily values. C. List of ingredients, nutrition claims, expiry dates. D. List of ingredients, nutrition claims, risk factor. For this, we'll be going with option A. Food labels contain the list of ingredients. Food labels contains the list of ingredients, which shows all the components used in the food product. It also contains nutrition facts, and this provides a detailed information on the nutrient contents such as calories, vitamins, and fats. It also has nutrition claims, highlighting specific benefits or qualities such as high fiber or low fat. This is why we're going with this option: list of ingredients, nutrition facts, and nutrition claims. The other options includes items like expiry dates, daily values, or risk factors, and these are not necessarily the 3 main components of food labels. Question 2. What does the triangle laundry symbol tell? A. How to dry items. B. If bleach can be used. C. If the garment needs to be dry cleaned. D. If the garments can be ironed. For this, we'll be going with option B. The triangle symbol on laundry labels indicates whether or not you can use bleach on the garments. There are different variations of the triangle. Some can be empty, some can have lines, and some are crossed out, and this provides a more specific instruction about the use of bleach. Drying instructions are usually shown with a square symbol, so that is not our answer. Dry cleaning is presented by a circle symbol, while ironing instructions are shown with an iron symbol. So whenever you see the triangle symbol on any piece of laundry, know that it shows if bleach can be used. Question 3. Stereotyping the elderly can lead to A. Ethnicity, B. Discrimination, C. Ageism, D. Both B and C. Stereotyping the elderly can often lead to discrimination and ageism. We'll be going with option D, which is discrimination and ageism. Discrimination is unfair treatment, while ageism is prejudice or discrimination based on age. Ethnicity is unrelated to stereotyping based on age. That's why we didn't go with that answer. So our answer here is options D, which is both B and C. Question 4. Which of the following statements about care of the circumcised penis is false? A. A gauze square covered in petroleum jelly may be applied on the baby's penis. B. Antiseptic cream should be applied. C. The penis should be thoroughly cleaned at each diaper change. D. Apply the diaper loosely to prevent the diaper from irritating the penis. Now, which of the statements is false? Looking through the option, instead of applying antiseptic cream, which is really not recommended because antiseptic can irritate the sensitive healing skin of the circumcised penis. So what we shouldn't be doing is option B. Antiseptic cream should never be applied to the circumcised penis. Instead, a gauze square with petroleum jelly is used to protect the area and prevent it sticking to the diaper. The penis should also be gently and thoroughly cleaned at each diaper change in order to keep it clean, and the diaper should be applied loosely to avoid pressure or irritation on the healing area. So our answer here is B, that is the statement that is false. Question 5. At what age do children start dressing themselves? A. Preschool age. B. Toddler. C. Middle childhood. D. Infancy. Children typically begin to start dressing themselves during the toddler age, which is around 1 to 3 years, and it starts with simple tasks like putting on their socks or pulling up their pants. So our answer here is option B. Infancy, which is from 0 to 1 year, is too early for self-dressing. And at the preschool age, which is 3 to 5 years, children have already improved their dressing skills and can dress more independently. At middle childhood, which is from 6 to 12 years, children can dress fully independently and choose their own clothes. So the age where they start dressing themselves is at the toddler age, which is between 1 to 3 years old. Question 6. What does spina bifida involve? A. Seizures. B. Abnormalities in the structure of the heart. C. Changes in the X chromosome. D. Improper closing of the spine before birth. Seizures are not a direct feature of spina bifida, though neurological problems can occur. Abnormalities in the structure of the heart relate to heart defects and not spina bifida. Changes in the X chromosome are genetic abnormalities and it is not linked to spina bifida. So our answer here is option D. Spina bifida is a birth defect where the spine and spinal cord does not form properly because the neural tube fails to close completely during early fetal development. That is why expecting mothers are advised to always take folic acid um, while pregnant so that it can help to complete the fetal development by ensuring that the spine and the spinal cord forms properly and closes. Question 7. Infancy has many changes, especially diet. What is the major dietary change in this stage? A. Starts drinking low-fat milk. B. Starts drinking high-sugar juices and drinks. C. Introduction of solid foods. D. Introduction of fast foods. During infancy, a major dietary milestone is the introduction of solid foods, and this is when the baby is about 4 to 6 months of age. However, this should include continued breastfeeding or formula feeding. Low fat milk in option A is usually introduced after 1 year of age, but it is not advised to be introduced during early infancy. High sugar juices and drinks and fast foods are also not recommended during infancy because they have a negative health effect. So in this question, our answer is option C. Introduction of solid foods is the dietary change during infancy. Question 8. What is denial? A. Limiting the conversation to a certain topic. B. A show of obedience, meekness, and compliance in the face of conflict. C. Restating someone's message in one's own words. D. An unwillingness to accept the truth or a certain reality. The scenario in option A describes limiting conversation, but it doesn't describe denial. B refers to submissiveness, and that is not denial. And C is about active listening techniques like paraphrasing. That is, in paraphrasing, you're restating someone's message in your own words. Looking at options A, B, and C, they are not the correct answer. Our answer is option D. Denial is a psychological defense mechanism where a person refuses to accept reality or facts. And they do this in order to avoid uncomfortable feelings. Question 9. Soaps do the following. A. Remove pigments. B. Remove hair. C. Moisten the skin. D. Remove dirt and dead skin. Soaps Do not remove pigment or hair, as we say in option A and B. And while they can leave the skin feeling clean, their main function is cleansing rather than moisturizing. So it is not option C. Soaps are designed to cleanse by removing dirt, oils, and dead skin cells from the surface of the skin. So our answer here is option D. Question 10. Which of the following is a principle of growth and development? A. The process proceeds from the moment of fertilization unto death. Option B. The process starts at fertilization and ends in puberty. Option C. The rate of process is even and at a set pace. Option D. The process proceeds from foot to head. Growth and development is a lifelong process which starts at fertilization and it continues throughout a person's life until death. Option B is incorrect because development doesn't stop at puberty. It actually continues. Option C is also incorrect because the rate of growth and development is not even or set. It varies at different stages of life. Option D is also incorrect. The usual developmental direction is from head to foot and not from foot to head. So our answer here is option A. Question 11. It is important for the PSW to report any of the signs and symptoms related to umbilical cord, circumcision sites, episiotomy sites, cesarean section sites, or breasts. A. Pain and swelling. B. Fever and chill. C. Foul odor, bleeding, or drainage. D. All of the above. For this, we'll be going with option D, all of the above. All the signs that have been listed and the symptoms should be reported promptly by the PSW in order to ensure timely care. Pain and swelling can indicate infection or complications. Fever and chills are a sign of systemic infection, while foul odor, bleeding, or drainage from any of these sites also suggests infection or poor healing. So all the signs and symptoms should be reported promptly by the PSW in order to ensure timely care. Question 12. What does the term disability mean? A. Loss of function. B. Any loss of physical and or mental function. C. Loss of self-direction. D. Loss of self-esteem. In option A, loss of function is close, but it doesn't really describe disability completely. Options C and D are specific types of losses, but they don't fully define disability. Option B actually provides a more comprehensive definition. Disability refers broadly to any impairments that affect a person's physical and or mental abilities. So our answer here is option B. Question 13. When the umbilical cord has not healed, the baby's diaper should be A. Disposable. B. Snug over the cord. C. Loose over the cord. D. Below the cord. For option A, whether disposable or cloth, this doesn't affect the specific care for an unhealed umbilical cord. In option B, the diaper should not be snug or tight over the cord because this can cause irritation or even delay healing. In option C, the diaper being loose over the cord may still cause contact and irritation. So option D is the most preferable option. Folding below the umbilical cord is recommended. So when it hasn't healed, the diaper should be folded below the cord and the area should be exposed to air in order to prevent irritation or infection. Question 14. When performing pericare on an uncircumcised male, you should A. Clean in a horizontal motion. B. Carefully retract the foreskin. C. Clean from the anus to the urethra. D. Apply Vaseline under the foreskin. In option A, this is not a standard instruction. Cleaning should actually follow a front to back direction in order to avoid contamination. In option B, while performing pericare on an uncircumcised male, the foreskin should be gently and carefully retracted in order to clean underneath it properly. After cleaning, it must be returned to its normal position in order to prevent constriction. Option C, cleaning from the anus to the urethra, is the wrong direction. Cleaning should be from the urethra to the anus, which is front to back, in order to prevent spreading bacteria. Option D is incorrect and it is not part of routine pericare. So our answer here is option B. Carefully retract the foreskin. And after cleaning, it must be returned to its normal position in order to prevent constriction. Question 15. Your client has pediculosis corporis. Which of these do they have? A. Infestation of the body with lice. B. A mite burrowing under the skin. C. Infestation of the scalp with lice. D. Infestation of the pubic hair with lice. Pediculosis corporis refers to lice infestation on the body, especially in clothing seams. A mite burrowing under the skin refers to scabies, so that is not our answer. Infestation of the scalp with lice is known as pediculosis capitis, so that is not our answer. While infestation of the pubic hair with lice, often known as crab lice, refers to pediculosis pubis. So based on the options we have, the correct answer is option A. Question 16. A back massage is given to A. Relax the muscles. B. Treat osteoporosis. C. Stimulate circulation. D. Both A and C. We'll be going with option D here. A back massage helps to relax the muscles and also to stimulate circulation. It is not a treatment for osteoporosis. Question 17. How often should an ostomy pouch be changed? A. Every day. B. Every 48 hours. C. Every 3 to 7 days. D. Whenever feces is present. For this, we'll be going with option C. Ostomy pouches are typically changed every 3 to 7 days or even sooner if there is leakage or skin irritation. Changing the pouch too often, like daily, can irritate the skin, and waiting too long increases the risk of leaks. Changing whenever feces is present may be necessary if leakage occurs, but it is not the routine schedule. It is usually changed every 3 to 7 days. The only time you can do that sooner is if there is leakage or skin irritation. So even if feces is present, it is only necessary if a leakage occurs. Question 18. Which statement about ileostomy is true? A. Good skincare is essential. B. The stool is formed. C. The entire small intestine has been removed. D. All pouches are one size fits all and fits well. In option A, with an ileostomy, the output is usually liquid to semi-liquid because the stool bypasses the large intestine. So skin care around the stoma is very important in order to prevent irritation. Option B is false because the stool from an ileostomy is usually not formed. It is more liquid. option C is also false because the entire small intestine is not removed. Only part of it is diverted. Option C is also false. Ostomy pouches come in different sizes and shapes in order to fit individual needs. So our answer here is option A. Good skin care is essential in order to prevent irritation. Question 19. What is the first sign of pressure injury? A blister. B, gangrene. C, a warm reddened area. D, partial thickness skin loss. A blister in option A usually appears later. This is a stage 2 pressure injury. Gangrene indicates severe tissue death at an advanced stage. So this is not an early sign. A warm reddened area is usually the first sign. So the skin is intact with non-blanchable redness. In option D, partial thickness skin loss is usually stage 2, so it is not the first sign. Our answer here is option C. The area may feel warm, firm, or soft, and it may be painful. So this is the earliest warning sign of pressure injury. Question 20. Deep, slow, and labored breathing that develops in response to diabetic acidosis is known as A. Bradypnea, B. Hypoxia, C. Apnea, D. Cosmal respirations. Bradypnea means abnormally slow breathing. Hypoxia is a state of low oxygen in the tissues. It is actually a condition and not a breathing pattern. Apnea is the absence of breathing. Cosmal respirations are deep, rapid, and labored breathing patterns that occurs as the body tries to blow off excess carbon dioxide in order to counteract metabolic acidosis. This is usually seen in diabetic ketoacidosis. So our answer here is option D. Question 21. A client has recurring episodes of violent and sudden contraction of her whole body that can last for up to 7 minutes. She loses consciousness and falls to the floor. What disorder is this client living with? A. Seizure. B. Cerebral palsy. C. Epilepsy. D. Spina bifida. Seizure is a single event. It is the sudden uncontrolled electrical disturbances in the brain that can cause violent muscle contractions and loss of consciousness. The described episodes in the scenario are seizures, but it doesn't describe everything that is happening. Cerebral palsy is a permanent motor disorder caused by brain damage before, during, or shortly after birth. It affects movement and posture, but it doesn't cause the sudden violent episodes of contraction as explained in the scenario. Epilepsy is a chronic disorder that is characterized by frequent or recurrent seizures. So the person lives with epilepsy and they experience seizures. In option D, spina bifida is a neutral tube defect and it affects the spine and spinal cord. It doesn't cause seizures. So based on the explanation, the disorder that the client is living with is option C, epilepsy. Question 22. Which of the following is a symptom of hypoxia? A. Slow, weak respirations and disorientation. B. Restlessness, dizziness and disorientation. C. Calm, clammy and weak pulse. D. Painful, difficult breathing and weak pulse. For this, let's break down the options. In option A, slow, weak respirations and disorientation. For a client or someone that suffers from hypoxia, the common signs are actually restlessness anxiety or confusion, dizziness due to low oxygen to the brain, rapid pulse, and increased respiratory rates, among others. In option A, it lists slow, weak respirations and disorientation. Disorientation fits a symptom of hypoxia, but the slow, weak respirations does not fit because a symptom of hypoxia is actually increased respiratory rate. So that is not our answer. In option B, restlessness, dizziness, and disorientations. These fit the symptoms of hypoxia. Remember, I listed restlessness, anxiety, dizziness, increased respiratory rate, rapid pulse, and cyanosis. So the symptoms listed in option B fits more to the signs of hypoxia. In option C, calm is not typical. So calm is not a symptom. So this automatically rules out option C. In option D, painful breathing can occur, but pain is not usually linked to hypoxia. So it doesn't fit. The only option that all the listed symptoms fit with hypoxia is option B, restlessness, dizziness, and disorientation. Question 23. Which of the following devices allows a client to talk and eat during oxygen administration? A. Venturi mask. B. Simple face mask. C. Nasal cannula. D. Partial rebreather mask. For this, we'll be going with option C. The nasal cannula has small prongs that rest in the nostril, so it leaves the mouth free for eating, drinking, and talking. It is usually used for low flow oxygen therapy. So this is our answer. I've also included a picture of what the nasal cannula looks like. So it doesn't cover any part of the face. The small prongs that comes with it rests inside the nostril and the tubes are passed behind the ears. So it leaves the mouth open for talking, drinking, and eating. Question 24. What does DX stand for? A. Diagnosis. B. Director of Nursing. C. Discontinue. D. Dead on arrival. For this, our answer is option A. DX is a standard medical abbreviation for diagnosis. Question 25. A pain that is felt in a part of the body separate from the source of pain is called A. Radiating limb pain. B. Phantom limb pain. C. Referred pain. D. Persistent pain. Radiating pain spreads out from a central point, but it is continuous with the source, so that is not our answer. Phantom pain is a pain that is felt in a limb that has been amputated, so that is not our answer. Referred pain is a pain that is felt in an area that is distant from its source. That is our answer. So the answer here is option C, referred pain. Persistent pain means it is chronic and ongoing. It doesn't speak about location. This brings us to the end of the practice questions and answers for the part 4 session of the NACC PSW 2025 exams. Don't forget to like, comment, and share, and also hit the subscribe button so that you'll be informed when our part 5 video will be dropping. Thank you for watching, and I'll see you in the next video.